Hello, I'm Karen Waldrop. I'm a GI oncology nurse navigator at the University of Alabama at Birmingham's O'Neill Comprehensive Cancer Center. And today I'm going to talk about equitable access to quality care for unresectable hepatocellular carcinoma, or HCC. This is session 2 of our series. This is shared decision making and overcoming challenges in treatment adherence. Okay, we'll start with disparities in care access and impact on patient outcomes. This slide shows that HCC disproportionately impacts racial and ethnic minority populations. As you can see, the white population clearly lives longer than our minority patients. Racial and ethnic disparities exist for HCC prognosis, with a median overall survival of 10.6 months for Blacks, 16.3 for white, and 14.4 for Hispanic patients. Illustrated here are disparities in liver cancer trial enrollment. This shows that men, by far, are enrolled in clinical trials more than women. Also, Asian and white enroll at much higher rates than Black patients, as well as Hispanic compared to our non-Hispanic patient population. These marginalized groups really need encouragement to participate in clinical trials, and this is an area where nurse navigators can assist. Impact of shared decision-making on treatment selection and the role of nurse navigators in adherence. The Academy of Oncology Nurse and Patient Navigators says the role of the oncology nurse navigator and oncology patient navigator is to support patients with cancer, their families, and their caregivers to assist them in overcoming any barriers they may be facing in the healthcare system, and facilitate timely and quality access to care through all phases of the cancer journey. The primary role of the oncology nurse navigator is to serve as a clinically informed liaison between the patient and the healthcare team throughout treatment and survivorship. Nurse navigators provide patient education and family support at diagnosis, connect patients with appropriate care, support, and personnel. Oncology nurse navigators work as a central point of contact between the patient and an often large and diverse multidisciplinary cancer healthcare team. The fragmented process and sheer scope of care needed to successfully manage a patient with HCC makes the role of the ONN in coordinating care and optimizing delivery indispensable. Within the multidisciplinary team, as key members of a multidisciplinary team, nurse navigators participate in case discussions, act as patient advocates on clinical issues, contribute to treatment decision-making with their knowledge of patients' preferences for treatment, scheduling, and other considerations. Patients with HCC should be discussed in multidisciplinary care settings. The MDC is made up of the medical oncologist, interventional radiologist, transplant surgeon, research coordinator, radiation oncologist, surgical oncologist, palliative care, oncology nurse, liver pathologist, cancer support groups, nutrition specialist, a hepatologist, tumor registry, and diagnostic radiologist. I often explain to patients that they have a whole team and they are the captain of the team. Our role is to provide recommendations, but ultimately it's their decision how to proceed with care for their life. The MDC is associated with increased curative treatment and reduced HCC mortality. Many factors need to be considered for treatment decision-making. Patient factors include their preference for treatment, performance status, comorbidities, their age, socioeconomic factors, and disease etiology. Treatment goals include quality of life and tolerability to extend overall survival and delay progression. Tumor factors include clinical stage, location, size, EHS or MVI, and the liver factors include cirrhosis, Child-Pugh, ALB-I grade, and portal hypertension. Multidisciplinary care and patient impact. So navigators first build rapport, provide education, and explore barriers to treatment. Current evidence indicates that lack of social support, insurance financial concerns, and problems with healthcare communications can negatively affect a patient's follow-up care after a diagnosis has been made. These issues can lead to unintended consequences in terms of medication noncompliance, proper management of symptoms such as pain or ascites, or ease of access to continued and timely care. When making treatment decisions for patients with HCC, you must consider the overall treatment burden. This goes beyond just the therapy itself. It includes several factors that can significantly impact a patient's experience and their ability to adhere to treatment. Key factors contributing to treatment burden include adverse effects that may compromise quality of life, the frequency of clinic or hospital visits for infusions, monitoring, or complications, comorbid conditions that complicate treatment selection and tolerance, the emotional impact of an HCC diagnosis, including anxiety, depression, and uncertainty due to limited treatment options, financial toxicity and the cost of therapies, insurance hurdles, and financial stress which may create barriers to care, logistical challenges such as transportation, prior authorizations, and scheduling conflicts, caregiver support concerns. Many patients may rely on family or friends, and they may worry about caregiver burnout due to lack of support for the caregivers themselves. And then the patients who are socially isolated and completely on their own. A comprehensive understanding of these burdens is necessary to making patient-centered treatment decisions. Addressing these challenges proactively can improve adherence, quality of life, and overall treatment success. Nurse navigators play a crucial role in addressing the potential burdens of treatment and improving patient-centered care. By proactively identifying challenges and advocating for solutions, they help ensure patients receive timely and appropriate interventions. Some key best practices for nurse navigators in reducing treatment burden include educating patients on treatment expectations and potential side effects to reduce anxiety and improve adherence, coordinating with the multidisciplinary team to optimize treatment plans that align with the patient's health status and personal circumstances, facilitating access to supportive care services, such as financial assistance programs, social work support, and mental health resources, advocating for simplified treatment regimens when feasible, particularly for underserved populations who may face logistical barriers to care, helping patients navigate pre-treatment requirements, insurance approvals, and scheduling to minimize delays and frustrations, engaging caregivers as key partners in the care process, providing them with resources and support to reduce burnout and improve patient outcomes. Treatment advances may support adherence. The advent of new agents has made the nurse navigator role even more important in ensuring patient compliance. Barrier to medication adherence includes health literacy, lack of understanding of the disease and risks of medication non-adherence, lack of belief or confidence in treatment benefits, age, gender, forgetfulness, and financial considerations. However, newer treatments such as intravenous IO therapies can help care teams ensure compliance as opposed to daily pill regimens. To address health literacy issues, my institution, UAB, has institution-affiliated cell phones that nurse navigators can text patients. Texting increasingly is becoming the most used form of communication for patients. Navigators can text procedure information, treatment details, plus text can be easily translated for non-native English speakers. This fosters independence within patients, empowering them with easy-to-access information. In conclusion, HCC is associated with a poor prognosis and the heterogeneity of the disease and the limited treatment options available pose many challenges. ONNs play a key role in multidisciplinary teams that serve patients diagnosed with HCC in terms of helping patients cope with their diagnosis and providing patient education throughout the cancer care trajectory, assisting in the management of adverse events, promoting medication adherence, serving as a central point of contact for patients and their caregivers, acting as a conduit of information among the treating physicians and between the patient and their healthcare team, and providing coordination of care. As clinically experienced specialists, oncology nurse navigators have the ability and knowledge to individualize patient care and improve overall outcomes by alleviating the burden patients face as they navigate through their initial diagnosis and beyond. Listed here are cancer resources. Thank you for watching. Learn more at accc-cancer.org/liver. This program was conducted in collaboration with the Global Liver Institute and Blue Fairy, and this program was made possible by support from AstraZeneca. Thank you for watching.